Hello and welcome. In this video we are going to be going over the myofascial lines of the body and their functions in posture and movement. Alright, we're going to start off with the superficial front line. So, starting all the way at the toes, the line travels up the tibialis anterior. It meets with the patella, or the knee joint, and then it separates into all four of the quadricep muscles, the medialis, the intermedius, lateralis, and rectus femoris. After that, it comes up to the inguinal ligament, which connects it to the rectus abdominis, all the way up, travels a little bit to the side, and onto the skull. So, the posture function is to maintain balance in the sagittal plane and stop anything that's happening with extension in the superficial back line. So, in regards to movement, it provides flexion in the trunk, hips, and feet. So, can you flex, move forward for me? Just like that. Just like that. Do it again. Yeah, just like that. Good. Next, we'll take a gander at the superficial back line. So, just like the front line, we're going to start at the feet, beginning with the calcaneus, or the heel. It travels up the Achilles tendon to the soleus and the gastrocnemius with both its heads right there. And they're connecting to the hamstrings, all three of them, the semimembranous, semitendinous, and the bicep femoris. Meeting up a little bit higher around the glute area, you have the sacral tuberal ligament, which connects it to the erector spinae. It travels all the way up the spine, all over top the occipital lobe of the skull, and then it finishes up on the brow. So the posture functions of the back superficial line is to basically stand up straight, just like how my dummy is here right now. Movement-wise, it provides extension and hyperextension along the back. So puff your chest out and lean back. Yeah, just like that. That's what the superficial back line does. Next, we're going to take a look at the lateral line. So, again, beginning at the foot. This one is really neat because if you look, it begins on the medial side of the foot, travels underneath and up the side of the body. So, the muscles it hits on its way up are the fibularis longus, that's right before the knee, or patella. The IT band, which then joins up with the external intercostals. And, well, first it joins up with the external obliques, and then lift up your arm. And then the intercostal muscles, which create this zigzag typing corset pattern all the way up. It goes around the scapula and up to the sternocleidomastoid. So its postural functions is to maintain balance in the frontal plane, so like side-to-side movements. And movement-wise, its function is to bend from side to side. So give me some lateral flexion, like bend side to side. Yes, just like that. Good. The last line we're going to look at is the spiral line. It is very unique because it crosses over the body, as you're about to see. So it starts up here on the skull near the mastoid process, and it travels around both the rhomboids, the major and the minor. After that, it keeps traveling. Lift up your arm, please. It would move a little bit farther down to the external obliques, across the abdomen, down some more towards the external obliques. Continues on its journey down the bicep femoris, the fibularis right here, and then it crosses back over to the tibialis anterior. And slight correction, this would not be the external obliques over here, that would be the serratus anterior. So its function is balance in all planes during just static posture, and for the movement function, it provides rotation of the body. So like just rotate left and right. Yep, just like that. There are two functional lines to the body. There is the frontal line and the back line. We will discuss both of them. Right now what you're looking at is the front functional line. Starts at the pectoralis major, travels down the rectus abdominis and aponeurosis, and goes down to the adductor longus, which would continue on with that. Turn around, please. On the back frontal line, it starts around the latissimus dorsi, goes down the thoracolumbar fascia to meet up with the glute max and vastus lateralis and subpatellar tendon. So, turn around. What is neat about these two lines is that their function is contralateral movement. So, touching your opposite arm and opposite leg together, like this. Would you kindly? Yeah, just like that. So like if you're throwing a ball in baseball or something, all the force is traveling from X to Y in that fashion. Of course, like rotation stuff as well. Posteriorly, they don't really have a function besides just major movement.